All right, so COVID remains among us, and I'm still wearing a mask at work every day, and it doesn't look like that's ever going to change for the rest of my working career, which is annoying to say the least. But what can you do, right? You need a job, so I'm going to keep wearing the mask. But what I want to do is just try to get a better handle on the numbers. I want to be a little more conversant with what is going on so that I can have a decent conversation with somebody about this when the time comes. Because for the first 2 years plus of the pandemic, I kind of took things as they came along. I didn't have a whole lot of choice anyways. I'm sure you didn't have a lot of choice. And so we just went ahead, did what we were told. And if we didn't do what we were told, we lost our jobs. Well, now we're going to try to get ourselves a little bit more educated on what's going on. So anyway, the dominant strain right now, ba4 and ba5, these are Omicron strains. And let's take a look at what's going on with this most recent subvariant of Omicron, which is called ba5. It's now the most dominant strain, and it's the most contagious subvariant so far. ba5 has the ability to evade the immune system, including immunity from vaccines or immunity from previous infection. Now, it seems to matter when considering the timing of that immunity and how that relates to the longer it's been since your previous shot or your previous infection. The longer the time frame, the less robust the immunity. One of the big questions about ba5 is, does this variant cause more severe disease? And so far, it's been very hard to know because first, it's still very early in the course of its spread, as well as another factor that I'll get to in just a minute. Hospital admissions are now rising with ba5 after several months of stable hospitalization rates. Now, as far as looking at data, you have all these different categories that people are falling into. You have the unvaccinated. You have people who received the vaccine. You have people who received the boosters on top of the vaccine. Then you have people who've had previous infections. Then you have hybrid immunity, where people had previous infection and vaccine or previous infections plus the boosters plus the vaccines. So trying to sort out all these different groups is really difficult. According to the CDC, there's still 1/5 of the US population that remains unvaccinated. Now, to make matters even more complicated, it's increasingly difficult to know the actual number of cases going on right now because most cases are coming from rapid antigen testing, which is being done at home. And many of those people aren't reporting the results, and so the actual numbers of COVID cases are probably a lot higher than what the data says. The other issue that complicates things is the fact that anyone who comes to the emergency department, for example, and maybe a potential admission is screened for COVID. So, for example, if you come in with a heart attack or a broken ankle or abdominal pain, and if they think there's a chance that you might be admitted to the hospital, you're going to get a COVID test right away. But at some point, if there's any chance that you might be admitted to the hospital, you're going to get a COVID test. Now, if the COVID test is positive, it's an incidental finding. I mean, I'm not admitting you because of COVID. I'm admitting you because of your heart attack or because of your ankle fracture that requires surgery. But you now are a COVID positive hospitalization. So, what I mean by all of this is that many COVID positive hospitalizations are being admitted, not because of COVID, but they just happen to have it incidentally. Yet the data available that I've noticed usually states that hospitalizations due to COVID are what's in the data set. And that's not entirely accurate, right? So getting back to ba5, two main reasons why it's so concerning. One is that it's very transmissible. It's the most transmissible subvariant yet. And the other are its Delta-like properties. And if you remember the Delta variant, which we had last year, which was pretty bad, the Delta variant had a really high affinity for the ACE receptor in the lung. And that was primarily why Delta was so pathogenic. The Delta variant, as well as the current ba5, seek out that ACE receptor in lung tissue, allowing it to invade deeper into the lung rather than the upper respiratory tract, which was more common with the earlier Omicron variants like ba1 and ba2. This is a big concern because it could result in more ICU admissions and possibly even deaths. So as ba4 and ba5 subvariants have become the dominant strains, we have to look at data that might reflect how concerned we should be. And I think that looking at data indicating ICU admissions are probably the best indicator of severe illness, as mere hospitalizations, as said earlier, may not be a direct result of COVID infection, but rather some other disease process for which COVID was an incidental finding upon screening. According to the most recent data, it seems to be that ICU admissions are in fact rising. In a recent report in the New England Journal of Medicine in July 2022, it reported that a vaccine-boosted population noted that antibody levels were 3 times less active against ba5 compared to the first Omicron subvariants, ba1 and ba2. Of course, antibodies are only one part of the immune system, as you also have the T cells and B cells, but antibodies are something that we can more easily measure as an indicator of immunity, despite arguable flaws in that reasoning. The thing with BA4 and BA5 is that research is suggesting that previous Omicron infections don't help the immune system effectively recognize and protect against subsequent Omicron infections. What that means is that if you've had an Omicron infection previously, you probably aren't going to enjoy protection against BA4 or BA5. The CDC continues to proclaim that vaccines, although not 100% effective or protective, do offer good protection against severe disease from BA5. Another thing that we don't really know yet is whether monoclonal antibodies are helpful against BA4 or BA5. So let's take a look at some data. So the first slide is the daily new confirmed COVID-19 cases. It shows a rise in the United States. I put the United Kingdom on here for comparison. They're experiencing a rise as well, but certainly not as drastic as the United States. The second slide shows the number of COVID-19 patients currently in the hospital. And the United States seems to be, again, seeing a sharp rise in hospitalizations. And a similar slide, weekly new hospital admissions for COVID-19. Now, this is supposed to be data that is indicating admissions for COVID-19. And it shows a very sharp rise, again, in the United States. And then finally, I think the most interesting and probably the most telling information is the number of COVID-19 patients currently in the intensive care unit. And again, the United States is leading the way and seeing a rise. So when you put all of this together, there's probably a lot of reason for concern because we're seeing a rise in cases, we're seeing a rise in hospitalizations, and we're seeing a rise in intensive care patients. So keep an eye on the intensive care admissions. I think that's the most important thing to take a look at right now because after all, what we're concerned about are people that present with severe disease, the people that are going to need the higher level of care, the ventilators or whatever it may be. And these are the people that we need to be most worried about. So with that, that's all that I have for today. And I'll talk to you again very soon when new data gets released. Thanks. Bye.